Most seniors think dizziness, shaky hands, or forgetfulness are just part of aging. But here's the shocking truth. Those normal moments, they could actually be mini strokes. They are silent alarms that many seniors ignore until a major stroke steals their independence. The good news? If you can recognize the overlooked warning signs, you can act fast. You can potentially prevent a life-changing stroke. In the next few minutes, I'll show you exactly what they are and what you can do. What are mini strokes and why should you care? A mini stroke, or TIA, is like a flickering smoke detector in your body. The danger might pass in minutes, but it's a critical warning that a full-blown stroke could be just around the corner. In fact, many seniors who have a mini stroke face a major one within months. During a mini stroke, blood flow to part of your brain is briefly blocked. You might feel weak, dizzy, or struggle to speak, and then it clears up, making it easy to dismiss. But that quick recovery is misleading. Every single mini stroke is a red flag that your blood vessels are in trouble. That's why recognizing the signs is life-saving. Ignoring them is like ignoring a fire alarm. You only realize the danger once the fire has already spread. Here are the 9 critical signs of a mini stroke, and what to do if you notice them. Sign number 9. Sudden weakness or numbness on one side. Have you ever felt your arm or leg suddenly go weak, like it's asleep? Or felt a pins and needles tingling only on one side of your body? This happens when part of the brain that controls movement isn't getting enough blood for a short time. Think of it like a power outage in one room of your house. Suddenly, the lights in that room won't work, even though the rest of the house is fine. For strokes, the same idea applies. If blood flow is blocked in the brain's movement center, your arm or leg can feel heavy, clumsy, or even dead. The scary part is that it often clears up in minutes, tricking people into thinking it's nothing. Martha, 68 years old. She was knitting when her right arm suddenly felt lifeless. She assumed it was just a pinched nerve and kept going. 2 weeks later, she had a major stroke that left her entire right side paralyzed. Why this matters? Weakness or numbness on one side is one of the most common early stroke warnings. The brain controls opposite sides of the body. So if the left side of the brain is struggling, the right side may suddenly weaken and vice versa. What you can do. Mark the time. Tell someone exactly when it started. Doctors use this information to decide on the best treatment. Test yourself quickly. Try lifting both arms. Does one drift down? Try smiling in a mirror. Does one side droop? Try walking a few steps. Do you feel uneven? These quick checks give you clues if it's more than just fatigue. Don't just wait it out. Even if the weakness fades, get checked within 24 hours. TIAs often come before a major stroke, and early treatment can prevent it. Sign number 8. Sudden trouble speaking or understanding. Imagine you're sharing a story with your family. Suddenly, your words come out slurred, like your tongue won't cooperate. Or maybe you can't find the right word. Perhaps you hear others speaking, but it sounds like gibberish. That's your brain's speech center struggling. It usually means blood flow to the part of your brain that controls language has been briefly blocked. Think of it like static cutting in on a phone call. Your brain is trying to send the signal, but it's not getting through clearly. A story that stuck with me is Tom, 72. He was telling a joke at a barbecue when his words got tangled. Everyone laughed, thinking it was a slip of the tongue. He brushed it off as a senior moment. A month later, he had a stroke that left him with permanent speech problems. Why it matters. Slurred speech or not understanding others isn't just a slip-up. It's one of the clearest early warnings of a stroke. The left side of your brain controls speech, and when blood supply is cut off, even for a minute, your words can get scrambled. What you can do. Mark when it started. Doctors need to know the exact moment symptoms began, as it can guide treatment. Test yourself quickly. Try saying a simple sentence like, "Today is a sunny day." If it sounds garbled, that's a big red flag. Don't wait for it to clear. Even if it improves in a few minutes, treat it like a fire alarm. Get medical help the same day. Tell someone nearby. Don't keep it to yourself. Ask them to listen to your speech. Others often notice problems you might miss. We've covered 2 signs, but sign number 7 is so sneaky that most seniors attribute it to something else entirely. Stay with me to find out what it is. Sign number 7, sudden vision problems. What if your vision suddenly blurs, or goes double, or you lose sight in one eye, like a curtain dropping down? That is a major red flag. This isn't about weak eyes or needing new glasses. It's about blood flow being cut off to the parts of the brain that control sight. When a TIA strikes, a tiny clot or narrowed artery can block blood supply to the visual cortex at the back of the brain, or to the optic nerve that connects your eyes to the brain. Without oxygen, these areas can't process visual signals correctly. So what you see becomes distorted, doubled, or suddenly lost. In many cases, these vision problems are tied to blockages in the carotid arteries, the main highways delivering blood to your brain and eyes. A partial blockage here can starve the brain's vision centers of oxygen for a few minutes, then clear up, tricking people into dismissing it. How it feels. It's not like slowly needing a stronger prescription. It's sudden, one-sided, and feels distinctly wrong. Some seniors describe it as seeing 2 of everything, losing vision in half the visual field, a shadow or curtain suddenly blocking one eye. Why it matters. Vision-related TIAs are particularly dangerous because they're a warning of a possible stroke in the occipital lobe or from a major carotid artery blockage. Studies show untreated vision TIAs can double your chance of having a full stroke within 30 days, and unlike eye issues, strokes can leave permanent blindness or visual impairment. What to do when it happens. Check if it's one eye or both. Cover one eye at a time. If vision loss is only in one eye, it often points to carotid artery issues. If both, it could be the brain's visual cortex. This info is useful to doctors. Don't try to walk it off or rub your eyes. If it's from a TIA, rubbing won't help. It only wastes precious time. Even if your vision clears up within minutes, treat it as a serious red flag. Carotid artery blockages often cause these warning shots before a major stroke. Sign number 6. Sudden dizziness or loss of balance. Imagine you're in your garden, a place you love. Suddenly, the world starts to spin. You have to grab onto the fence just to stay upright. That feeling of losing control, out of nowhere, that is often a mini stroke, affecting the cerebellum, the part of your brain that controls balance and coordination. When blood flow to this area is briefly cut off, your brain can't keep your body steady. So you feel like you're tilting, swaying, or even about to fall. This is tricky because seniors often mistake it for inner ear problems, dehydration, or low blood sugar. But when it's a mini stroke, it's your brain's way of warning you something serious is happening. I read about Sarah, 69 years old, who felt dizzy while watering her plants. She thought it was just low blood sugar, grabbed a cookie, and sat down. 3 weeks later, she had a stroke that left her needing a walker. If she'd recognized that first dizzy spell as a warning, she could have acted sooner. Research shows that sudden dizziness tied to circulation problems in the back of the brain often predicts a stroke within weeks if left unchecked. What you can do. Sit immediately so you don't fall. Falls are one of the top causes of broken bones in seniors. Pay attention to when it started. If dizziness lasts more than a few minutes, this isn't normal aging. Get emergency help right away. Check for other signs at the same time. Is your speech slurred? Do you feel weak on one side? Do a quick self-check. It could save you precious minutes. Even if it passes, don't dismiss it. Book a doctor's appointment within 24 hours to check blood pressure, heart rhythm, and carotid arteries. These are often the hidden triggers behind mini strokes. Coming up, sign number 5 is so common that most seniors think it's just stress or fatigue, but it's a major stroke warning. Sign number 5. Sudden severe headache with no clear cause. A sudden, powerful headache, one that feels like a thunderclap inside your head. And there's no clear reason for it, not from stress, skipping meals, or dehydration. This is more than just a headache. It happens when blood flow in the brain is suddenly interrupted, and that pressure triggers pain-sensitive areas inside the head. Think of it like this. When the brain isn't getting enough steady blood flow, it screams through pain. This can be one of the earliest warnings that a bigger stroke is on the way. Unlike a normal headache that builds up slowly, this kind comes on fast and feels very different from what you're used to. Linda, 70 years old, thought her sudden headache was just from missing her morning coffee. She took an aspirin and went about her day. A week later, she had a stroke that left her wheelchair bound. If she had recognized that this wasn't her usual headache, she might have gotten the help that prevented it. Why it matters for seniors. These headaches are more common in people with high blood pressure. High blood pressure makes blood vessels weaker, so when flow is disrupted, the brain reacts quickly with pain. That's why this is so dangerous. It's not the pain itself, but the warning behind it. What you can do. Notice the difference. If the headache comes on suddenly, is unusually strong, or feels different from your normal headaches, treat it seriously. Mark the time it starts. This helps doctors know if you're in the window for critical stroke treatments. Don't just reach for a painkiller and hope it goes away. If it's severe, go to the ER right away. If it passes, still schedule a checkup within 24 hours, especially if you have high blood pressure. Doctors can check for artery blockages before a bigger stroke happens. Sign number 4. Sudden confusion or memory lapse. Have you ever had a moment where you suddenly feel lost? You can't remember what you were just doing, or where you are, or even why you walked into a room. It's easy to laugh it off as just aging. But in reality, this could be your brain struggling to get enough blood. When part of the brain's thinking center is starved of oxygen, even for a few minutes, it can trigger sudden confusion, memory lapses, or trouble focusing. That's why doctors warn brief confusion can be an early sign of a stroke waiting to happen. Studies show that seniors who ignore this symptom have a much higher chance of having a full stroke within 90 days. What you can do. If confusion comes on suddenly, tell someone near you right away. Don't try to cover it up or brush it off. Even if it passes, this is not a sign to ignore. Make an appointment within 24 hours for a stroke risk check. Your doctor may order simple tests like a blood pressure check, heart rhythm scan, or carotid artery ultrasound to find the cause. Keep a small notepad or phone with you to jot down the episode. What happened, how long it lasted, what you were doing. This makes it easier for doctors to catch patterns. Think of it this way. Your brain is like the control tower of your body. If it suddenly loses signal, even briefly, that's a red alert, not just a senior moment. Sign number 3. Sudden trouble walking. If you suddenly feel like your legs won't listen, like you're stumbling and can't keep your balance, it may not be simple clumsiness. This can happen when the part of your brain that controls movement and balance doesn't get enough blood for a few minutes. Think of it like a traffic jam. Your brain isn't getting the go signals through clearly, so your legs freeze or wobble. A man named John, 71, tripped while walking his dog and brushed it off as a misstep. A month later, he had a stroke that made walking difficult and required months of therapy. What he thought was just age was actually his body sending an early warning. Why it matters. Walking trouble during a mini-stroke is dangerous because it often means the areas deep in the brain that control balance and coordination are being starved of blood. If that blockage becomes permanent, it can cause lasting disability, like needing a cane or walker for the rest of your life. What you can do. Pause immediately. If you're standing, sit somewhere safe to avoid a fall. Check yourself. Try lifting both legs or walking a straight line. If one side feels weaker or you can't balance, it's a red flag. Sign number 2. Sudden facial drooping. If one side of your face suddenly feels numb or droops so you can't smile evenly, this is one of the clearest red flags for a stroke. This happens because a mini stroke briefly blocks blood from reaching the part of your brain that controls facial muscles. When that area goes offline, even for a short time, the muscles on one side of your face stop working the way they should. How it looks. You might notice your mouth sag on one side. Your eyelid may feel heavy or look uneven. When you try to smile, one corner of your mouth doesn't move. Why it matters. Facial drooping is not just a weird moment. It's your brain telling you that blood flow is being interrupted. If blood flow isn't restored quickly, those brain cells can die. In fact, every minute during a stroke, around 2 million brain cells are lost. That's why acting fast is so critical. What you can do. Do the smile test. Stand in front of a mirror and smile big. If one side droops or looks uneven, that's a red flag. Ask someone to check. If you're with family or friends, ask them if your face looks different. They often notice it before you do. Sign number 1. Sudden trouble swallowing. Difficulty swallowing, like food or water feeling stuck or coughing every time you sip a drink, can be a rare but very serious warning sign of a mini stroke. This happens because The part of your brain that controls swallowing isn't getting enough blood for a short time. Think of it like your body's swallowing switch flickering on and off. Even if it lasts only a minute, it's your brain telling you something is wrong. A 73-year-old woman named Ellen was having tea when she suddenly choked a little and felt like her throat wasn't working right. She brushed it off as dryness. Just 2 weeks later, she had a major stroke that left her unable to swallow without a feeding tube. Why it matters. Trouble swallowing is especially dangerous because it can make food or liquid slip into your lungs instead of your stomach, leading to choking or pneumonia. That's why this is so critical. What you can do. If swallowing feels off, stop right away. Don't try to push through it. Remember the time the problem started. Stroke doctors use the clock to decide on the best treatments. If it lasts more than a few minutes, get emergency help right away. Now that you know the 9 signs, the next part is critical. What you do after a TIA can significantly cut your stroke risk. Stay with me to learn how to protect your brain and your independence. As we age, our blood vessels naturally narrow, and the prevalence of risk factors like hypertension, diabetes, and heart disease skyrockets. Many seniors have at least one chronic condition that increases stroke risk. For example, high blood pressure, a very common issue for seniors and a leading cause of stroke. Diabetes, this can double your stroke risk. Atrial fibrillation, this can significantly increase your stroke risk. Moreover, seniors are more likely to dismiss symptoms due to the misconception that feeling off is just part of aging. Many seniors delay seeking medical care for TIA symptoms, which increases their stroke risk. My aunt, Clara, 76, ignored a brief episode of confusion while shopping, thinking she was just tired. A stroke, 3 months later, left her unable to drive, one of her favorite activities. Knowing these signs could have changed her outcome. Quick question. Have you or someone you know ever had one of these warning signs? Drop it in the comments, because your story could literally help another senior catch theirs in time. Coming up, I'll share 5 science-backed steps to protect your brain after a TIA, including one simple habit that can dramatically cut your stroke risk. Keep watching to learn how to take control. How to protect yourself after a TIA. Step 1. Act fast. The FAST acronym is your first line of defense. F is for face. Ask the person to smile. Does one side of the face droop or look uneven? A is for arms. Can they raise both arms? Watch to see if one arm drifts downward. S is for speech. Is their speech slurred or strange? Are they able to speak or understand you clearly? T is for time to call for help. Note when the first symptoms appeared and call emergency services immediately. Acting within a few hours of symptoms can significantly reduce stroke damage. Clot-busting drugs can restore blood flow and prevent permanent damage if given soon enough. Think of FAST like a fire drill. You practice it to be ready. Keep a note with the FAST acronym near your phone as a reminder. Step 2. See a doctor within 24 hours. Even if symptoms disappear, a TIA is a medical emergency. Seeing a doctor within 24 hours cuts your stroke risk. Your doctor may order brain imaging, a scan to check for blockages, ultrasound, to assess carotid arteries where blockages increase stroke risk, blood tests, to check cholesterol and blood sugar. Consider Robert, age 67, had a brief episode of vision loss but felt fine afterward. He saw his doctor the next day, who found a significant carotid artery blockage. Surgery reduced his stroke risk. Step 3. Manage blood pressure. High blood pressure is the #1 cause of strokes. It affects many seniors. Check your blood pressure daily with a home monitor, aiming for a healthy range. Think of your blood vessels like garden hoses. Too much pressure can cause a burst. Cutting back on salt can lower blood pressure. Try flavoring food with herbs like rosemary instead of salt. Lowering your blood pressure can significantly reduce your stroke risk. Step 4. Review your medications. Some medications, like blood thinners, can reduce stroke risk. However, others, like some common pain relievers, can increase it. What to do? Ask your doctor to review your medications, especially if you take multiple drugs. Taking many medications, a common issue for seniors, can increase stroke risk. Step 5. Adopt brain-healthy habits. These lifestyle changes can significantly lower your stroke risk. Diet. Follow a healthy diet rich in fish, nuts, vegetables, and olive oil. This diet can cut stroke risk. For example, eating salmon provides omega-3s that reduce inflammation. Exercise. Walk regularly. This simple habit can reduce stroke risk. Even chair-based exercises, like leg lifts, can improve circulation. Sleep. Aim for 7 to 8 hours nightly. Poor sleep increases stroke risk, as it raises blood pressure and stress hormones. Stress management. Practice deep breathing or meditation for a few minutes daily. Stress reduction can lower stroke risk. Relatable tip. Think of your brain like a garden. Nourish it with good food, water it with exercise, and give it rest to thrive. Additional stroke risk factors for seniors. Atrial fibrillation, AFib. AFib is an irregular heartbeat that can cause blood to pool in the heart, forming clots that can travel to the brain. It affects many seniors and can significantly increase stroke risk. If you have AFib, ask your doctor about medications that can reduce stroke risk. Wearable devices like smartwatches can also detect irregular heartbeats. Diabetes. Diabetes doubles stroke risk by damaging blood vessels and increasing inflammation. It affects many seniors. Monitor blood sugar daily. Maintaining stable blood sugar reduces stroke risk. Avoid sugary drinks, which can spike blood sugar. Smoking and alcohol. Smoking doubles stroke risk by narrowing blood vessels, and heavy alcohol use can also increase it. Quit smoking. There are many resources available to help you. Limit alcohol intake. Obesity, a common issue for seniors, increases stroke risk by raising blood pressure and cholesterol. Aim for a healthy weight. Losing even a small amount of weight can reduce your stroke risk. Recognizing these 9 signs and acting fast isn't just about preventing a stroke. It's about protecting your independence, your ability to enjoy time with your family, and your freedom to live life on your terms. Many people have a stroke each year, and a significant number of seniors who have a stroke lose their ability to live independently. The surprising habit to protect your brain. Here's a surprising habit that can make a big difference: sitting less. Sitting for long periods daily can increase stroke risk in seniors. Instead, stand or walk for a few minutes every hour. This simple habit improves blood flow and reduces stroke risk. Think of your body like a river. Stagnant water breeds problems, but flowing water stays healthy. Set a timer to stand and stretch every hour, even during TV time. Let's recap the 9 signs of a mini stroke. Sign number 9, sudden weakness or numbness. Check one side of your body. Sign number 8, speech issues. Watch for slurring or confusion. Sign number 7, vision problems. Blurry or double vision is a red flag. Sign number 6, dizziness. Don't dismiss spinning or imbalance. Sign number 5, headache. Sudden severe pain needs attention. Sign number 4, confusion. Brief memory lapses aren't normal. Sign number 3, walking trouble. Stumbling could signal a TIA. Sign number 2, facial drooping. Check your smile in a mirror. Sign number 1, swallowing issues. Difficulty swallowing is serious. In the 5 steps to protect yourself, step number 1, act fast. Use the FAST acronym to spot symptoms and call 911. Step number 2, see a doctor. Get evaluated within 24 hours to cut stroke risk. Step number 3, manage blood pressure. Keep it in a healthy range to reduce your risk. Step number 4, review medications. Ensure your meds aren't increasing your risk. Step number 5, adopt brain-healthy habits. Eat well, exercise, sleep, and manage stress to cut your risk. The hardest part is taking that first step to pay attention to your body. If you found this video helpful, please share it with someone over 65 who needs to know these signs. It could save their life. And let me know in the comments which of these signs surprised you the most, or if you've experienced any of them. Your story could inspire someone else to act. Here's that game-changing question to ask your doctor. Could any of my current medications or conditions be increasing my stroke risk? A simple adjustment could prevent a stroke. For more tips to stay healthy and independent, hit that subscribe button. Subscribe, because every tip we share could mean more years of living freely on your own terms. Let's keep learning together to live stronger, longer, and in control.